Good morning. I'm Angela Hefner with Walden University. Today I'm going to talk about a kiddo that has ADHD. He's a 12-year-old Caucasian male presenting for evaluation of his ADHD and his adjustment disorder. He's been doing relatively well at school with a low grade in reading. He does have a reading disability, otherwise good at home. His current medications are guanfacine ER, Strattera, and clonidine, and he feels he's doing well on those, and he reports academically he's doing well, minus the D that he's receiving in reading. His attention is okay, and he is not overly hyperactive. At home, he's become less argumentative, but at times mildly resistant without temper outbursts. So that is a positive turn. He reports sleeping well, not requiring the use of his clonidine, and he does well to focus throughout his day. His biggest problem is he continues to eat poorly and is a very picky eater. He has recently broken his right growth plate in his right leg, and it's not healing as fast as expected because his nutrition is very poor. We pushed more protein for healing, more fruits and vegetables, but we shall see on the next visit. He is to be reassessed for his leg injury, and they're going to go ahead and let it grow and then do lengthening procedures later on. So this is going to be on the kiddo's mind for some time and a huge stressor. He is compliant with his medications, no SI or HI, no plans or intent, no psychosis, no speech delay, motor or vocal tics, and no social skills delays. His past psychiatric history, no past sexual abuse, no tobacco use, no illicit drug use, no previous medications or hospitalizations. He was previously diagnosed with ADHD from another provider. The adjustment disorder was added on by the other provider as well. There's no substance abuse history, as we spoke about. For family history, the mother has anxiety and the maternal grandmother has depression. The patient has always lived with his parents and denies any physical or sexual abuse by them, and there's no legal charges or problems with the police. The patient has no known drug allergies. He did have a hemothorax at birth, which he spent 7 days in a NICU after surgical correction. And just last year, he had correction for bilateral estropia. His current medications, as discussed, were the Strattera, guanfacine guanfacine, and clonidine. And prior, he had tried Wellbutrin, clonidine, Metadate CD, Adderall XR, which none of them worked, and the Adderall made him spaced out and agitated, while the Metadate CD, he was not able to sleep for days. His review of systems were remarkable, minus the musculoskeletal with the tib-fib fracture in the growth plate. Objectively wise, the same thing, the musculoskeletal with the fractured tib-fib. And the diagnostic tests that we use for ADHD are Vanderbilt ADHD Assessment, and it's a validated tool to help parents and teachers and for us to gather all the information we can for diagnosis. His attention for his mental status examination, he's younger. He appears younger than his stated age. He was dressed casually and groomed. Attention is poor. The patient is pleasant and cooperative, oriented to person, place, and time. His mood was good, constricted affect. Speech was normal. There was no pressured speech. He denied any hallucinations or paranoia. There's no SI or HI. And for my differential diagnoses, I chose attention deficit disorder. It includes hyperactivity, impulsivity. This child has all of this, inattention and decreased focus. Adjustment disorder was number 2. It's related to it's most frequently seen in practice. It is a response to a stressful situation, which this child did experience with his behaviors and emotional support and whatnot. And it caused significant impairment in functioning. So that was number 2. And then for the third, I chose generalized anxiety because he was restless, he's easily fatigued, he is very much so has difficulty concentrating, irritability, and sleep disturbances. And There's not really much I would change on that assessment, and overall, I think the patient's doing well minus his musculoskeletal issue. And thank you and have a great day.